We're very pleased to be joined by Laura Bajuni, Jill Carina, and of course Erin Laylaw from the Alcohol and Drug Foundation.
Now, the strategies to reduce cannabis-related harm are varied and complex, and today we've got an opportunity to talk about many of these.
I know you've also mentioned that the youth should not be punished if they use or because it's counterproductive. But I just want to know, is this the reason why you're saying it has to be evidence-based?
When we talk about wanting more evidence, it's really around the impacts of policy change on possession of cannabis. So we know from the international experience that there are a whole lot of different models that can be used when we talk about regulating or legalising cannabis.
I think that investing in prevention is critical no matter what model of reform we're looking at, whether that's a decriminalisation model a la Portugal, whether it's legalisation a la Canada. We should be investing in prevention in any regard.
Now, what are the benefits of the prohibition regime that we have in Australia at the moment? Is there any benefits that would be removed if that regime was to be taken away?
The position of the Alcohol and Drug Foundation is that we need to look at drug use as a health issue, not a criminal issue.
Recognizing oftentimes the interaction with the criminal justice system that occurs because of the criminalization of personal use and possession is far more detrimental to the individual than the drug use itself.
If Australia was, or if Victoria was going to go down this path of decriminalisation or legalisation, what sort of mistakes or missteps have other countries or states made that we could learn from and not make?
The primary issue with decriminalization over legalization is that the issue of drug trafficking remains in terms of cannabis offenses. When we talk about decriminalization, we are not advocating for the removal of criminal penalties for drug trafficking. That should absolutely still be a criminal matter.
What are the programs that you deliver, and what has your evidence shown after what I think is many years and many clubs' engagement with these programs?
We do run a number of primary prevention programs. One of them is the Good Sports program, and one is the Local Drug Action Team program.
There's a huge range of activities, and every community is a little bit different in the way they approach it, and I think that's a really critical part of how we do local drug action teams, is actually working with the local communities to design a program that's going to work in that community for that community, and that's going to be sustainable in the longer term.
While some people might experiment with cannabis, I want to see them not be harmed by that experimentation, and to be able to do so in a setting where they are supported, they're connected with their community, they have positive relationships with their family members, they have great sport and recreation activities to be parts of their lives, so that maybe they use drugs occasionally, but they're not harmed by that use.